Tired of hallway medicine and hopeful for an improved healthcare system in Ontario? Well, Doug Ford's stealth healthcare reforms are already being pushed through the bill-making system and could, like everything else he's interfered with so far in his time as Premier, make things worse. Hi, I'm Chantal, and in this video I'm going to be unpacking Doug Ford's new healthcare bill. What are the changes that we're looking at, what it could mean for Ontario, and what it is that we can do to maybe stop it. After continuous denials that the Ford government had already made decisions about our healthcare system, without our input by the way, the Conservative government finally revealed the changes they secretly designed for our province. How did this reveal happen? Well, first, they denied any changes had been signed off on, even after a copy of those very changes to our healthcare system were leaked. And they continued to deny these changes up until the day the Conservative government were ready to have their new healthcare bill heard in the legislature. Yep, they revealed plans for a new healthcare system by quietly drafting a bill and moving it through Queen's Park on its way to becoming official. Rapid changes may sound good to some, but let's break down what we're dealing with here. Let's start with the entire process. We can agree that long wait times for hospital care are a major issue. But how patient-centered can a healthcare system be, as a Health Minister Christine Elliott insists these changes are, when there had been minimal, if any, input from patients and prospective patients? You know, us. The secrecy around the whole thing alone is cause for alarm. If I were working on an innovative, amazing, patient-centered healthcare reform, I would proudly promote that process well ahead of tabling. But what we've seen is the Conservative government commenting on these changes in very vague terms when they're up against criticisms. And there are a lot, for good reason. But, characteristic of the way the Ford government has conducted its business thus far, secret meetings were carried out. He enlisted the time and services of all the government employees required to draft a bill, paid with our tax dollars, of course, and rushed it right to legislation. There's been no transparency in the creation of this bill. Ford has actively discouraged public consultation, and very few details about changes to our healthcare have been made available to the public, even now. Moving on from how quickly the Conservative government is moving on this, let's take a look at the bill itself. Doug Ford wants to create what he calls a super agency. It's as nefarious as the name suggests. Currently, our province has 14 not-for-profit health agencies that coordinate healthcare services across the province. These are called Local Health Integration Networks, or LHINs. LHINs are in charge of the healthcare services delivered in your community. They decide where funding goes and are responsible for things like hospitals, mental health and addiction services, care for seniors and long-term care home facilities, as well as community health centers. While Ford's new healthcare bill doesn't explicitly state what health services will remain covered under OHIP and what they plan to remove, it does, however, lay down a groundwork that would allow for reduced or even eliminated services and privatization. Currently, each LHIN has a board of directors of up to 9 members who meet at least 4 times a year for public meetings. Under these new laws, there will only be one board of directors comprised of only 15 people making judgments about all of Ontario's healthcare. This single board will also meet 4 times a year, but these meetings are now not required to be open to the public. Board meetings that are open to the public allow community members like you or myself a chance to make appeals, to see firsthand what decisions are being made about our healthcare services and who to hold to account if changes proposed negatively impact your community. Basically, like all the decisions made under Ford, the health services that receive funding in your community, the types of care offered, or how you can access them will now be made behind closed doors. One reason the LHINs were created in the first place was to make our healthcare services less disjointed and easier to navigate. Our current healthcare system is, of course, not perfect. There are inefficiencies, and getting necessary care for you or your family can be frustrating. But the LHINs are far closer to a healthcare system that best serves the needs of Ontario than these reforms. The LHINs, with all of its issues, empower local communities who are aware of their own distinct needs to manage the health services and resources in their region. These new laws completely scrap that framework. And, most troublingly, the Health Minister and the Premier have also given themselves the power to unilaterally, without anyone else's say-so or input, order closures, move services from one location to another, or to even hand services from one entity to another. For example, not-for-profit services to a for-profit facility or corporation, because they all now fall under the super agency umbrella. And in this new bill, transferring services between the two is fair game. Perhaps some of you are thinking, just because the Premier can doesn't mean he will use that power to, say, close or reduce or remove services. Besides the fact that he endowed himself with the power to do just that, what we already know about the Premier based on his track record thus far is that he hates spending in the public interest, and he loves using and abusing his power. Another reason why consolidating the LHINs into one super agency is a bad idea is the fact that, unlike Ford's speedy healthcare changes, research was carried out. There were public consultations, there were efforts made to understand the needs of each region across Ontario, and all of these efforts went into designing the LHIN system. In each area, frontline and community support workers, people who provide care and health services, outlined the special and distinct needs of their respective communities. Things like higher need for addiction support services, the need for population-specific health strategies. For example, places with a higher population of seniors or Indigenous communities or Francophone communities all have specific and distinct needs that have different priorities in terms of where funding is going and what kind of care is available. People in rural communities, people who don't live in city centers, for example, have a harder time accessing quality healthcare for reasons like transportation. If you don't have a car or money for gas, then just getting to a healthcare facility is an issue. Never mind if the type of care you need is even available in your community. These are just a few examples of the kinds of issues faced by different communities. With these changes, just 15 people, not 9 people for each area, are now responsible for being aware of these issues and also making sure each varied and distinct need is met in a way that is effective, efficient, and transparent. That is a difficult feat, if at all possible, for a board of 15 people to manage across the province. In an interview for the CBC, Dr. Rob Cushman, a former director of one of the LHINs, called the Premier's plans, quote, a step backward. In the interview, he pointed out that not only would these changes result in a Toronto-centric healthcare system, which isn't good news for those of us who don't live in Toronto, which is a lot of us because Toronto. But with a far greater area in which to provide healthcare, like in a province of over 14 million people, and far fewer people to manage these services, means the overlooking of local need, according to Cushman, is inevitable. The issues don't end there. While the health minister has stated in interviews that these changes are the first of a kind, that isn't completely true. In 2009, Alberta dissolved its regional health services into a super board. What resulted were what many people, including health professionals and journalists, have described as chaos. Instead of saving money and relocating money that went to operating the regional care system into more care providers, there were actually layoffs. And there wasn't more coordination, there was less. As it turned out, it was difficult to communicate with everyone involved in providing care across the province. Let's talk about privatization. Will the Ford government privatize healthcare? Of course, Ford won't confirm his ultimate plans for healthcare or his bottom line. Transparency is off-brand for his administration, but these changes certainly allow him to do exactly that. What's worse is that making people pay out of pocket for services that used to be covered under OHIP isn't even how bad things could get. Research finds that health services provided by for-profit entities doesn't ensure better care. In fact, for-profit care actually results in worse health outcomes for patients, meaning people were less likely to receive quality care under a for-profit model because for-profit clinics prioritize profits over giving patients the best care. If it costs for-profit firms more resources, meaning money or physicians, to care for a patient than to generate a profit, then the choice is to provide minimum care to maximize profits. And these aren't the kinds of services we want Doug Ford and the health minister having unprecedented power to mess with. The super agency would include the ability to meddle with services provided by Cancer Care, for example, or Trillium Gift of Life, which manages the province's organ donations, or Health Force Ontario, which manages recruiting and keeping healthcare professionals. Again, our current healthcare system is far from perfect, but these are not the changes we need to solve those issues. And these changes may not even be about improving healthcare, but about maximizing the Premier's already vast power. This isn't an issue to ignore because the outcome will be loss of life and a widening gap between the province's lower and middle classes and the very wealthy. As the cost of living increases and it becomes more difficult to afford basic necessities or even raise families, healthcare, at least healthcare services we don't currently pay for out of pocket, shouldn't suddenly become another expense. So what can we do? All hope isn't lost. There are things we can do to prevent the worst from happening, and here are 5 things you can do to stop the Ford government's changes to healthcare. Call or contact your elected representative, especially if you live in an area represented by the following MPPs who voted to move ahead with the bill.
I was rooting for you. We were all rooting for you. How dare you? Learn something from this.
Call or contact Health Minister Christine Elliott. She also deserves to know that we won't stand for a healthcare system that truly isn't patient-centered. You can also contact the Premier's deceptively named Council on Improving Healthcare and Ending Hallway Medicine. You can do so at hallwayhealthcare@ontario.ca. Feel free to direct your messages to Dr. Ruben Devlin, who is the Premier's special advisor and chair of the council. He was given an annual salary of $348,000 plus expenses for his advisory role in changing our healthcare, so he too deserves to know what you think about a healthcare system that doesn't prioritize your needs. Doug Ford also, and most especially, needs to offer us explanations into his decisions concerning our healthcare. You can email him at doug.ford@pc.ola.org. You can also call his offices at Queen's Park at 416-325-1941, or you can call his constituency office at 416-745-2859. But wait, that's not all. You can also message him or give him a call on his cell. He's made that number available to a number of people, and I think you deserve to have it. So you can message him at 416-805-2156. Leave him a message letting him know what you think about his creating a healthcare system that violates our rights as Canadians who, under the Canada Health Act, are entitled to healthcare that is accessible and publicly funded. Finally, on April 30th, the Ontario Health Coalition will be holding a rally outside of Queen's Park. Consider going if you can make it. Just a note, I am not affiliated with the organization, but I do think they do good work. You can find further resources for understanding the new healthcare bill and our healthcare system in general on their website. Thanks for watching. Don't forget to like if you found this video helpful. This is a space to engage with topics of interest to me and you. So if you have any questions, concerns, or requests for future videos even, feel free to comment below. Bye!